All right, well, why don't we turn to that now, and Jane, I think you're going to walk through some of the major activities in three sort of pillars of foundation work. One is on relating to safety and better evidence. Second major area involves pre-competitive standards and data analysis efforts, and a third area is related to building scientific capacity. These may not end up being exhaustive to the types of projects that the foundation undertakes, but they do, in terms of our preliminary work, this has been for the board a useful way of categorizing some of the major activities that are starting now and that we're thinking about and working through undertaking in the months ahead. So, Jane, let me turn this over to you.
As Mark said, you know, we're here to support the mission of the FDA, and so the first question is, you know, how do you come up with, when you think about the mission of the FDA, it's just enormous. So where do you start? And so this is our first look at and our first attempt at starting some projects and trying to build capacity in certain areas that we think are priorities. So this really is a result of a discussion between the FDA and Reagan-Udall for quite a while to come up with these as our preliminary priorities. However, as Mark said, there will be many other things later on that I think will be added to this list, but for right now, this is what we're trying to focus on. So in these three buckets, I'm going to start with the pre-competitive standards and data analysis programs, which is a little bit of a mixed bucket. We have two projects that we actually have up and running, funded projects, and then we have one that's in process or in development, and I'll talk about each of these briefly. So let me start with the problem, the critical path to TB drug regimens, tuberculosis drug regimens. If you think about the problem with TB, you can see that had 8.8 million incident cases of TB and 1.4 million deaths from TB worldwide in 2010, and my understanding is that a third of the world's population is infected with tuberculosis. So while we don't see a lot of that here in the US, it's an enormous global problem. And on top of that, new therapies, the first-line TB therapies are nearly 50 years old, and so when you look at that scenario, you can see where there's great need. And the treatment regimens are long and intensive, and so after the CPTR, which is the abbreviation for critical path to TB drug regimens, after that group sat down and really thought about it, the mission is, as you can see it here, is really to bring together a public-private partnership to really look at this and figure out, basically, can this group work together, the pharmaceutical industry, the regulatory agencies, all sorts of NGOs, and of course we're talking about that this is in an international setting, and can we come up with a multi-drug regimen that could be developed together and potentially evaluated together? And so that's quite challenging. It would have implications in the long term for other diseases like oncology and AIDS, where you need a multi-drug regimen. So we are just part of a smaller group. The CPTR is run by the Bill and Melinda Gates Foundation. That's where we got our funding from. And I'll talk a little bit about our role. We work in a couple of different areas. Again, there probably are 9 pharmaceutical companies and one not-for-profit drug developer in the mix, as well as folks from the FDA who participate and the EMA participate on a regular basis. The TB Alliance, which provides more than drug development, they're a not-for-profit TB organization out of New York. And then there are all sorts of groups around the world that are working on this. The countries that we focus on, the high-burden countries, are, or the areas, are Sub-Saharan Africa, India, China, Russia, Brazil are kind of the main focuses. And so we work together as a very large group. Now, Reagan-Udall's role, obviously we're a smaller startup organization, but we're working right now on trying to identify current regulatory science challenges. And so we're working with folks from all of these different countries, and we're looking to put a meeting together to really come to a consensus on regulatory science challenges. Again, not regulation per se, but actually regulatory science challenges. And those can include not only the science themselves, but also training that's needed with various countries. So that's in process. We're developing guidelines for best practices around community and stakeholder engagement as it relates to TB clinical trials, and we actually have a meeting, which the board doesn't even know about yet. There's a meeting down in South Africa that we'll be going to, where we'll be working with a lot of the stakeholders, putting together good community practices related to stakeholder engagement. And then we're also working on trying to look at the issue of access. We've started off looking at pre-approval access, and then we're also looking at post-approval access issues in all of these various countries, and trying to come up with a plan to address some of those. And then our last and not least, role is that we liaison between FDA and the CPTR. So as I said, the Bill and Melinda Gates Foundation is our funder, and they've given us a 3-year capacity building grant to do that. So that is a project that is funded. It was approved by the FDA, it was approved by the Reagan-Udall board, which is our process, and we actually have funding from the Gates Foundation.